Hi everyone, this is Dr. Amrika Seshadri. I am a plastic surgeon. Today I want to talk to you about dimple plasty. So what is a dimple? Now, in this case I'm talking about face dimples. So dimple, if you're born with it, there's a muscle called the zygomaticus major which goes from the side of your mouth all the way to your cheekbones. And the muscle has two parts to it. And sometimes there is a bit of a space between the two parts, which is why it's typically found at the junction of the outer part of the eye and the outer part of the face. So this is where an ideal dimple would be. And dimple plasty is where, let's say God has not graced you with a dimple, but you would like to enhance your appearance somewhat without undergoing any major procedures. So a dimple plasty gives the charming look to any face. There are a few prerequisites though. So you need to be in general good health. You should not have any serious dental issues because this is inside the mouth surgery. You should not have had any invasive procedures to the cheeks, for example, like any kind of like jaw wiring surgery, etc. But other than these conditions, which are, like I said, understandably a little rare, other than these, you're actually a medically good candidate for dimple plasty. So how do we do it? First, I ask the patient where would they desire their dimple to be with a mirror in front of them so that they really understand it. And that is marked with a marker on the face. And then internally, I go ahead and create that space between the muscles and make sure that that space remains. So they are called retaining stitches. So yes, there are stitches involved, and no, they are not visible on the surface of the skin, they're all on the inside. There are a few basic precautions that need to be taken after dimple plasty. It's very similar to how, they say brush your teeth twice a day, use your mouthwash regularly, avoidance of fermented foods such as dahi for about 14 days. But other than that, there are no big restrictions. So this is something which is done in the OPD basis, and then you are sent home after an hour or two to make sure that there is no bleed or there is no swelling. It's relatively painless. It's no worse than getting like a root canal therapy done. So pain is not really a factor. Now let's talk about whether you are a candidate for it aesthetically speaking. What kind of patients would a dimple plasty suit best? So patients who have very narrow faces are not very good candidates for dimple plasty. A, because they already may have faint dimples of their own, or B, because the placement of it would be too on the outside, so it may not give them the effect that they like. Who are good candidates? People who have very round faces, people who have relatively squarer faces. It doesn't matter if you are a man or a woman. Dimples suit either gender. It would look lovely on the face. But what is really important here is that you have to choose whether you want one-sided dimples, which is a very popular choice, or you want dimples on both sides, or you want one to be a little deeper than the other. So all of this is very customizable. It depends on what you're really looking for. But yes, so continuing, if you have a round face, a heart-shaped face, or a square face, you are excellent candidates for dimple plasty. One, because A, you end up with dimples which are very pretty, and then two, because while we do dimple plasty, there's a subtle planing of the face that occurs. So what they remove completely during surgeries such as buccal fat removal, we just shape subtly so that you get a bit of cheek flattening, but not making it go hollowed and aged looking. So that does not occur. It leaves you looking much more youthful. And finally, when your dimples do come in permanently, they will only be visible when you smile. So when you have like a neutral face, like no expression on your face, the dimples are not visible. And then when you smile, your dimples will pop. So this is what I had to say about dimple plasty and whether you are a good candidate for it. Thank you for watching this video. Please don't forget to share, like, and subscribe, and I will see you later.